In this video, we will talk about how to treat acid reflux without medicines. Acid reflux is a condition that causes stomach acid to back up into the esophagus. This can cause symptoms such as heartburn, indigestion, and trouble swallowing. The most common form of reflux is called GERD, gastroesophageal reflux disease. It occurs when acid from the stomach leaks out into the esophagus. This happens when the lower esophageal sphincter, a ring of muscle at the bottom of your esophagus, doesn't close properly. This allows food and stomach acid to come back up into your mouth. GERD is very common in people who are overweight or obese. A study found that nearly half of overweight people and 2/3 of obese people had GERD symptoms at least once per week or more often than not. Watch this video to the end to find out what food to eat and what food to stay away from. Other symptoms include dental problems. You may experience heartburn and acid reflux after you eat. This could be caused by dental problems such as impacted wisdom teeth, a misaligned bite, or an overbite. If you have dental problems that cause your jaw to clamp down too hard on food, when you chew it can make it harder for your stomach to digest food properly, causing more gas and bloating. This causes more pressure in your esophagus, which leads to acid reflux and heartburn symptoms. Chills and fever. Chills and fever can be signs of a number of illnesses, so if you have these symptoms it's important to see a doctor. If you have a fever, however, there are some steps you can take to reduce your discomfort. Take paracetamol or ibuprofen as directed on the package. These medicines will help with any pain and discomfort caused by your illness. Drink plenty of fluids, water, soups and juices to stay hydrated. A dehydrated body is more susceptible to infection, so it's important that you keep yourself well hydrated at all times. Sudden weight loss. If you're losing weight rapidly, it could be that you're suffering from an acid reflux. If you notice that a sudden weight loss has been accompanied by any of the following symptoms, make sure to talk with your doctor. Anxiety and depression. Feeling guilty about eating. Obsessing over food and dieting behavior. The key thing to remember is that acid reflux are not only physically dangerous, but also psychologically destructive. They can cause severe health problems like heart failure and death, so if you think that you might have one, see a doctor right away. Stomach pain. Stomach pain is a common symptom of acid reflux. Stomach pain can be caused by many conditions and should be evaluated by your doctor to determine the source of your symptoms. Other causes of stomach pain include heartburn, ulcers, gallstones, inflammation of the stomach lining or esophagus, gastroesophageal reflux disease, and other gastrointestinal disorders such as irritable bowel syndrome. The location of the discomfort may suggest what is causing it. Upper abdominal pain suggests that you are experiencing heartburn or a condition called gastroesophageal reflux disease, GERD. If this is caused by GERD, then it may be relieved with lifestyle changes and medications. If these do not work, then surgery may help relieve some of your discomfort. Lower abdominal cramps suggests that you have an infection in your intestines, gastrointestinal tract, such as diverticulitis. Low back ache could indicate an inflammatory condition in the digestive system, such as Crohn's disease or ulcerative colitis. Feeling tired. Feeling tired is a common symptom of acid reflux, but if you're feeling more fatigued than usual, it's important to talk to your doctor. Excessive fatigue could be a sign of other health problems, like diabetes or anemia, so it's crucial that you see your physician for an examination. If you regularly experience fatigue after meals and have been diagnosed with acid reflux, this may mean that acid is regurgitating into your esophagus and irritating it. This can cause pain in addition to making you feel exhausted and groggy throughout the day. Coughing or belching up liquid or food that tastes bad. When you're experiencing acid reflux, it's common for the taste of food to come back up. This is most likely a sign of heartburn, which happens when stomach acid backs up into the throat and causes a burning sensation. If this happens to you, don't panic, you're not dying. It could also be caused by something else entirely, such as allergies or even an infection in your throat. If you think there might be an underlying cause behind your bad taste in mouth besides acid reflux, such as asthma, see a doctor immediately. You might also experience a metallic taste in your mouth when you wake up, especially if you have acid reflux at night. This is because regurgitated stomach contents can be tasted with an unpleasant metallic flavor due to digestive juices coming in contact with the mouth's mucous membranes. Some common types of reflux you can expect. Esophageal spasm, a disorder of the esophageal muscles that can cause heartburn and burping after meals. It is more common in people who have gastroesophageal reflux disease, GORD, but can affect anyone. It may be caused by anxiety or eating too quickly, among other factors. Can also cause chest pain unrelated to eating. Heartburn is caused by stomach acid flowing back up into your gullet, causing a burning sensation behind the breastbone, sternum. Reflux laryngitis, irritation of the voice box from acid reflux, which causes coughing and difficulty swallowing. How to treat acid reflux without medicines. Avoid eating large meals or eating late at night. Avoid spicy and acidic foods, as they can trigger acid reflux. Don't eat foods that are difficult to digest, as they will sit in your stomach longer, causing more heartburn and indigestion. Stay away from high-fat foods, including fast food and fried foods like chips and French fries. Fatty foods may contribute to acid reflux symptoms by delaying the emptying of the stomach contents into the small intestine when nutrients are absorbed into the bloodstream. Limit sugar intake, because sugar causes an increase in stomach acid secretion that can lead to heartburn symptoms for some people with GERD, gastroesophageal reflux disease. Sugar also contributes calories without providing any nutritional value. Another factor that contributes towards obesity, which is a known risk factor for chronic diseases such as diabetes and hypertension. If you are liking this video so far, please subscribe to our channel so that YouTube can share this video with more amazing people like you. The easiest way to avoid burping after eating is not to swallow air in the first place. This may require changing the way one eats and drinks, example, no carbonated beverages, or eating more slowly. When swallowing food or liquids, one should endeavor to keep the air out of one's throat as much as possible by making sure not to gulp or swallow air. Some foods are better than others when it comes to reducing burping after eating. Top 5 food to eat to treat acid reflux. 1. Almond milk. Almond milk is rich in calcium and vitamin D, which are good for the bones and teeth as well as the digestive tract. It also helps with digestion and prevents acid reflux by neutralizing the acidity in your stomach. 2. Yogurt. Yogurt is a probiotic food that contains friendly bacteria that can help balance the pH level in your body. This makes it easier for you to digest food and absorb nutrients efficiently. 3. Bananas. Bananas are great at neutralizing stomach acid, and they also have high levels of potassium, which helps reduce inflammation in the digestive tract, making it easier for your body to digest food easily without having any burning sensation or gas after meals. 4. Rice cakes. Rice cakes are extremely low on calories, but they contain a lot of fiber that helps control blood sugar levels and prevent constipation, as well as heartburn and nausea associated with acid reflux disease, GERD. 5. Applesauce. Acids are normally found in your stomach, but when they leak into the esophagus, they can cause heartburn. Applesauce contains pectin, a soluble fiber that soothes the stomach by drawing excess acid out of your digestive tract. It also contains malic acid and sorbitol. Malic acid is a natural antacid that helps neutralize stomach acids, and sorbitol is a natural laxative that promotes bowel movements. We hope that you now have a better understanding of what foods can help with acid reflux and which ones to avoid.
Please remember, we are not medical professionals, so please speak with your doctor before making any changes to your dietary requirements. This video is for informational purposes only. We hope you enjoyed this video. If you have any helpful tips, please do not forget to share them in the comment section down below. Also, before you go, please hit like and subscribe, which helps support this channel. We have lots of other videos which will help you make the right decision. Thank you so much for watching the video all the way to the end. The Health Study team really appreciate your time.